Hello everyone. In this particular video, we are discussing about the forecasting COVID-19 cases using time series modeling and association tool mining literature paper. Let's get on to the first slide. In this, the main agenda of this uh, video presentation is to mainly discuss about the abstract, introduction, materials and methods, tools, results and discussions, and then the conclusion of this particular literature review paper. When getting to the abstract, the aim of the study was to evaluate the most effective combination of autoregressive integrated moving average, which is also called as ARIMA, a time series modeling and association rule mining ARM techniques for identifying the meaningful logistic factors that predict the number of cases for effective COVID-19 crisis management. When coming to the part of the introduction, effective management of the COVID-19 crisis necessary, accurate forecasting of case numbers, and the identification of the key prognostic factors to optimize resources allocation and healthcare using auto regressive integrated moving average ARIMA and associated rule mining ARM. When coming to the methods that are we discuss in this particular paper mainly is time series analysis and association analysis. In this work, we present a study for combining the time series analysis and association analysis to forecast the COVID-19 admitted cases as well as the analyze their potential factors and characteristics to estimate the number of new cases and to predict the prognosis for better understanding of the current situation and progression of COVID-19. We explored the auto regression integration moving average ARMA model and its subclasses. In this particular image, we'll be discussing about uh, which is the summary of the time series and association analysis. In this particular thing will be it is a flowchart which is related to this model, uh, which is associated for associated rule mining, and this will be giving as an input to this here. And then this is the time series analysis ARIMAX, and this is, it is a flowchart. When coming to the auto regressive AR model, in this AR model, the predictive value at the time period T is modeled by the observed value at various time slots. It is, for example, if we consider the time as t and will be subtracting -1, -2, and so on. The impact of the values at various previous time period on the value at the current time is determined by the coefficient factor at the particular period of time. With this assumption, the model performs the regression of past time series and then calculate the present or the future value in the series, commonly known as the auto regression AR model. It can be modeled as follows. This is the main basic uh, equation that we follow in this model. Uh, in this thing, this is the graph where it indicates the number of patients with respect to the time frame. The ARIMA forecasting values of the admitted patients with prediction confidential intervals CI between 5 and 95. When coming to the results and discussions, in this study, the time series models were trained using 6 training datasets. The first training set, which includes all waves, cover all datasets, wave 1 to wave 4 of 228 days. The second training set, wave 1 of these are the particular days, like 34 days. The third training set for wave 2 of 45 days, and wave 4 of, and this is the way the dataset contains. When coming to the discussion, the first wave of SARS and COVID-2 were observed in early 2020, and the second, third, and fourth waves rapidly spread from early to mid 2021, respecting an unpredicted phenomenon in medical services, society, and the economy of Thailand. The number of COVID 19 patients shown in the study increases from the first wave of just 59 patients to 311, and then you keep on increasing in the second wave, third wave, and the fourth wave, respectively, which was more than 30 times of the total number of patients admitted in the field hospitals. When coming to the conclusion of this particular review paper, the study demonstrated that the ARI-MAX model has potential to increase the accuracy for predicting the number of COVID-19 cases by incorporate the most associated prognostic factors identified by ARM techniques to the ARIMA model. The result of this study proved to be an effective AI model to predict the number of and to identify prognostic factors of admitted COVID-19 patients. Yeah, thank you for giving me this great opportunity for explaining the basic introduction that I have given about this paper, and I have explained you briefly around the paper. Also, there is a review that we have that I have given to this particular paper. Now let's get on to it. Now, this is the particular review that I have made by myself. The purpose of the study is evaluating the effectiveness of combining aggressive integrated moving average ARIMA and associated tool ARM model to identify the COVID-19 cases. We can also identify the aid that are allocated for hospitals during the COVID-19 pandemic. It also refers to the identification of association rule mining, which help us in predicting the accuracy of each model. When coming to this related literature, uh, the healthcare, it finds the methods and approach for giving the resources to healthcare sector, such as hospital beds spent per patient that are mandatory during the COVID-19 pandemic and so on. Predictive modeling. We have requirements for finding mathematical and statistical models for finding the outcomes based on the historical health data. When coming to this research design or strategy, it works like initially we'll be collecting the data collection. The collected data is in the electronic form. The data contains individual patients' data like lab reports, uh, radiographics, and clinical data. And coming to this analysis, the study use analysis techniques like ARIMA to find the patient's hospital time over. ARM is used to finding the patterns and the and the relations between different patients to healthcare behavior. And when coming to this data characteristics, the study uses 3685 samples of data containing the data like age, mass, index, infection sources, length of the stay of the particular patient in the hospital, and so on. When coming to this result discussions and conclusions, in this paper, the results are presented in time series analysis and associated rule mining. It also discusses the impact of healthcare services due to COVID-19 during the pandemic. It also states that the model potentially in mining, managing the sector during the pandemic. When coming to the contributions that are made by the author of this paper, the major contributions involved in the paper is to develop and demonstrate the time series analysis and rule mining in prediction and managing the pandemic situation. When coming to the critical analysis, the overall assessment, the paper is very much simple for understanding as the information in the paper is very much related to everyone as the COVID-19 pandemic, it happened very recently. When coming to the research and methodology, My understanding with this paper is the paper is related to COVID-19 pandemic situation. The paper published has taken several methods for validating the results, study results. When coming to the statistic analysis, uh, we are using some multiple methods. They're gonna do calculations like mean, median, and standard deviation of the healthcare data that the patients have. When coming to the future research, the scope, the paper can further be improved by incorporating additional data such as environmental situations, health conditions based on the geographical location conditions. As the days passes, different data analysis methods will evolve as time, so it can be further improved as well. What are the knowledge that I have gained with this paper is as the data model used and the methods that are used for analysis in the paper is very much related to data science, which helps me in further doing research on some other methods that we use for data analysis for predicting the best outcome. What are the two different questions? These are the two different questions that I got when I'm going through the paper. They are how can we use time series analysis for best for each and every individual patient as the population of the world is very huge. When coming to the second question, that is, what are the important challenges that we face during the process of collecting the individual data electronically, which is a very great task, and it is also not possible of collecting each and every individual data electronically. Yeah. Thank you, me, for giving me this great opportunity, for giving me this review and briefly explaining about the review paper. Thank you.